Hello, everyone, and you're welcome to this edition of the Dialogues for the Reset. And I'm delighted to be having this dialogue with Professor Mishal Khan at the London School of Hygiene and Tropical Medicine. She's Pakistani. And the reason why I really wanted to have this conversation with her is that she has been shedding a lot of light on the role of knowledge in global health, and especially in the context of preparing for health systems for disease outbreaks and what that means for the future. And I'm also in the knowledge business. I am Seye Abimbola. I am an academic at the University of Sydney in Australia, and I'm also the editor-in-chief of BMJ Global Health. And I'm also part of the Health System Governance Collaborative, which is hosting this conversation. And in a lot of my discussions with Mishal, we've talked a lot about knowledge. So this our conversation is not the first we're having a conversation about this. But I just want to quickly ask Mishal to sort of, by way of introducing herself, to talk a bit about her thoughts about the idea that public health knowledge flows from the West to the rest of the world, or from the global North to the global South. What are the implications of that for COVID-19, but also for the future?
Yeah, thank you. Thanks for the introduction, and great to be chatting about this again. See, as I started noticing this. Obviously, this is a phenomenon that's unfortunately very deep rooted. But I've examined and noticed during COVID and the response to it, even from the early days, that it became very apparent, this perception that Western countries will be better prepared and have the knowledge, and that countries in the East, or countries that are sort of the lower income countries, should necessarily learn from them. And the case I'd like to make is that this, apart from the social justice issues, etc., it's not just detrimental to the Eastern or low income countries, but it's also detrimental to the Western countries. This idea that their systems are so strong that they don't need to learn from others. And this really did play out in COVID, where countries in Europe and the US were, they were slower to respond, and also a lot of the innovations or the lessons, say from Ebola or from SARS, weren't learned.
Yeah, thank you very much. It makes me think a lot about this idea that our biases about where expertise lies and where knowledge could come from is perhaps killing us. And I use us there in a very global sense. The idea that if it was the United States and Europe that got COVID correct, the rest of the world would have learned from them. And I suspect much more quickly than it has happened the other way around.
Yes.
That is something to ponder.
Yeah, I mean, in a way, I think if that had happened, it would have really kind of solidified that notion, and it would have driven that even deeper. But I suppose my question to you is, it's obvious that hasn't happened. But still, do you see the things shifting? Because as we've discussed, it's a very deep-rooted notion. So going forward, do you think there will be a shift in this notion about where expertise and knowledge is held, or what do you think is needed to do that?
The saying that never let a crisis go to waste. Sort of the idea of capitalizing on whatever you can sort of make good you can make of a crisis. And I think it's an example of COVID-19 for the future. The idea that it's clearer, I think, to the world, that the world is not this irresistible flow of knowledge from one part to the other, that it is a network world, and that different nodes of that world know how to do things better than other nodes of the world, and that the determinants of those are not just income level or being Western or in European, that it is a much more decentralized knowledge landscape. And that's one big lesson to learn, I think, from COVID-19. And I also think that COVID-19, for some reason, has happened at a time when there's a lot of calls for decolonizing global health, and there's a lot of Black Lives Matter, protests around the world, people sort of demanding things in a way that also reminds everyone that we all have very similar problems, right? That the world is not sort of perfect in one side and problematic on the other side. There's so much potential to learn from one another. And I think if there's something to take from COVID-19, it is that is really true. And that is, I think, unavoidably true because of pathogen.
Very much so. It's I think it's exposed that this sort of very simplistic view that we've held and are perhaps even teaching is just not true.
Yeah, thank you. There's another question I want to pose to you, and perhaps we could also have another discussion about, which is how do we, I mean, in a world in which it's very clear, perhaps clearer than ever, that knowledge is decentralized, and that for the most part, if there's another lesson from COVID-19, is that people seem to know more than the system, if that makes any sense. That individuals know more than any central entity knows within the system. And I'm just wondering, how do you think we could make better use of the knowledge that exists within systems than we've done in the past?
Yeah, you're very right. I mean, there's an imbalance in where knowledge is perceived, as we discussed, sometimes between East and West, or higher income countries and low income countries, but also say within a country, I think there's an undervaluing of knowledge that's held within community-based organizations, or what we'd call sort of, the frontline healthcare providers, and often they're doing the delivery, but they're not being asked to inform policies. So yes, absolutely, that's another, and I think the common theme is this idea of knowledge being held by the elites. That applies both to East versus West and within countries. In terms of moving past that, what I've been reflecting a lot on, even on a personal level, is there's one thing which is to ask the system to change, and there's also to reflect on what we can do as scientists, or as people who are, say, community-based experts, I would call them. So on the side of what you can do yourself, I would say that we need to become more just better at advocacy, and making sure that the knowledge that we have is if people aren't taking it willingly, then really make it upfront, and come together a platform, so better communication, or a better coming together and better coordination. So that's, I would say, the push factor of making sure that policymakers listen. And then hopefully, if there is now a greater appreciation of the value of knowledge that's outside of the traditional realm of expertise. And I think in a lot of countries, even scientists are sort of marginalized, because it's sort of medical doctors that, in the context of UHC, that often means that the policy decisions are skewed. In the UK, there was a lot of reliance on modelers, so just different countries have different types of experts that they over rely on. And so I think then, policy making platforms need to be really deliberate in being broader and making sure that they include experts that they perhaps wouldn't naturally consider experts.
Interesting. I mean, you mentioned modelers, and my mind just went to the one of my most interesting experiences with COVID-19 as a journal editor, which was the before COVID sort of landed in Africa. So there was this huge anticipation, sort of March, April, that this thing was coming and it was going to be disastrous. And right about then, a manuscript was submitted to DMJ Global Health from WHO Afro. And this manuscript was sort of counter to every projection, was saying, it's going to be bad, but not very bad. It's going to look like this in terms of numbers. And here is why. And this manuscript went into the details of context and sort of broke down more than any other manuscript I've seen submitted to the journal or published elsewhere, but what kinds of factors would play into the spread of COVID-19. And it was published. And after it was published, there was a lot of sort of emails to me personally saying, I think this paper is wrong, from all over the world. I don't want to mention countries, but that this paper is wrong, that this couldn't be right, that this is magnitudes of orders of magnitude lower than what our projections say. Right.
That's right.
And then sort of fast forward 5-6 months down the line, and it's held. Interestingly, it's held. And my theory there is that those who made that model knew what they were talking about because they were more in contact and in touch with the ground, as it were. And just this idea of what kinds of roles an academic publication in that context plays in drawing local knowledge and helping to make local knowledge most useful to solve local problems. I think it's going to be important going forward. And another thing that I think is interesting about this particular paper is that before it was submitted to the journal, it had had its impact in the world. I mean, it had been what WHO Afro was basing their sort of advice and strategies on already, which was sort of a kind of humbling experience for me as a journal editor, that this paper is in the world already, it's doing whatever it's going to do in the world, it's just come to me for some kind of validation through the peer review process.
Yeah.
And COVID-19 sort of makes that very clear to us, that in many instances, our academic publishing system sits, on one side, and decision-making processes is on the other side. And so the fast pace of COVID-19 decision-making happening makes it very clear to us that it seems that the world is not as, ordered and simple as our approach to it as academics or as knowledge people would suggest.
Yeah, that's very interesting. It's sort of like it's perhaps even the power that some of the journals are holding might change then.
Yeah.
So and do you think that's already happening? How do you see the role of academic journals a few years time post COVID, and is it going to happen naturally, or do steps need to be taken to kind of to have a more optimal role for them?
I think academics are some of the most conservative people in the world. I don't think the system that we have, they're going to change without deliberate thought and action, and perhaps some push as well. I think the reality is very clear that the way that the directions in which knowledge moves, it's not as we have often thought, and that the role that journals play in the learning ecosystem of a system is not as central as we would like to believe, and as our career structures would make us believe, and sort of reorienting what it is that makes an academic tick, for example, reorient what it makes an academic sort of important, will require a lot of deliberate action by universities and by decision makers too, but also by journals. And we would have to realign, I think, our incentive systems and our prestige systems. They're not always the same, with the reality, which is that often learning happens through local organic processes. What we do on sort of a few steps removed is important, but often the primary theater of action is when, where you're getting your hands dirty and doing the real stuff. And to put respect, right, there where it's due is not going to be a simple process, but I think it's going to happen.
Discussion as well, which is like a myth, right? A myth about where knowledge is held, and also kind of the way in which knowledge is legitimized, and the idea that the first step is when it's published, whereas what you're saying is that actually if something is useful and valuable, whether it's published in a journal or not, it's going to have an impact, and how much we value that needs to be questioned.
Yeah. There's something I often say, that the literature knows very little compared to what the world knows, right? So just reminding myself of that again and again. So the literature knows very, very little. And often we go into the literature and we say there's no knowledge about this thing X, whereas the world knows. We just need to go and ask people and they'll tell you, what is,
You need to look elsewhere, yeah.
Yeah, very often we will need to have to reorient ourselves. I think COVID-19, that lesson is clear from COVID-19. Like if you were looking, for example, by the number of publications about preparedness that a country has as a yardstick for preparedness, you'll be completely misled. Right? So again, which shows that there are learning processes going on within countries, within systems that the literature and the academic knowledge infrastructure does not capture. And the question is, should we be capturing that, or should we just leave the world to be and we face the things we face? I mean, these are, I believe, the kind of questions that we would have to ask ourselves in a more serious way going forward.
Yeah, absolutely.
Another question that I wanted to ask you, and we might talk about a bit, is also what you think may be the impact of a slowing down or a withdrawal of international aid for countries, especially given um, the kinds of financial straits that COVID-19 has put traditional donor countries. What do you think the impact of that would be?
It's actually been very topical here in the UK as well, because quite recently the budget sort of from the 0.8% of investment in international aid has been reduced to 0.5. And I think, rightly, a lot of people who are working in the field and feel passionately about this see that as, from the point of view of say, the UK or the countries that are giving the aid, it's a bad sign in terms of their commitment to international development. So while I see that argument, I think it's important to not have the knee-jerk reaction that it's going to mean that these countries that are the recipients are going to crumble. Very much so, related to this idea that you were discussing also, let's just not have a knee-jerk reaction that Africa is going to be devastated. Let's examine the facts. And the facts are that aid also has a lot of negative impacts, specifically in terms of skewing the priorities of which areas within which disease areas are focused on, and often in very vertical programs. So it means that primary healthcare and universal health coverage might have been naturally more prioritized if it hadn't been funding that's coming in very siloed ways. And then even within a particular disease area, so like in the TB world, for example, where I've been doing a lot of work, the value put on local knowledge, because the people who are holding the money or are often seen to be holding the expertise, or they determine which consultants come in, and so this idea of community-based knowledge that we're talking about also naturally gets neglected. So the areas in which solutions are planned, and then also the types of solutions are often shifted or sort of distorted because of aid. So there might be some opportunities for more self-determination if we're trying to be optimistic. No doubt there'll be challenges, but it might not all be bad.
Interesting that you mentioned that. I've had several colleagues and friends across countries in Africa, Nigeria, Kenya, South Africa, and also in Bangladesh, who sort of said that one of the dividends of COVID-19 has been the withdrawal of often in-person technical support. That then sort of leaves control of things in the hands of people who are sort of local, and the kind of confidence boost that comes from doing it yourself, right? Which, whether intended or not, didn't quite happen before because someone else was there. You could send your sample to the UK, even though you had laboratories in, Bangladesh, but you thought, let's send it to the UK. So the idea that some doors were shut meant that people could look inwards and draw strength and confidence from the ability to do. And there's a lot of learning that comes from doing, right? And I've seen that at work in Nigeria, for example, where so the NCDC has just been doing all of this stuff. And the act of doing means that you get better in after each round of it, and you get more confidence too. And I think all of those are really important for using local knowledge, right? Because if you are not learning, you are not generating that knowledge for yourself and by yourself. And you also don't have enough confidence to use what you know to solve your problem. And I think it's hard to put a positive spin on COVID-19. And I think what we've been doing a lot in this conversation is putting a positive spin on it. Sort of saying that there are knowledge dividends and learning dividends that I think it exposes to us as a people. And perhaps that is one way to look at the future. How does COVID-19 change how we think about knowledge in public health and in the future? Mishal, do you have any final words before we close?
As I said, I think what we've discussed and what's important is for everyone to take a step back, maybe in 2021, and challenge the assumptions and the myths about knowledge, about the value given to knowledge that's held by different groups, or the way that it's disseminated, whether it's in a journal, etc., and just question that, I would say.
Yeah. Thank you very much. It's been lovely having this chat with you, Mishal. And yeah, thanks for the opportunity to have this conversation on HSG. Bye.